Although most failing dental implants present with pain or swelling, there are some circumstances where patients may be completely asymptomatic. This often occurs when implants are not necessarily infected or inflamed, but rather when they lose their bony integration, and instead they develop a soft tissue, what's known as a fibrous union. So, what are the signs of an asymptomatic failing dental implant? And how do you treat it? Let's explore such a case. But first, please make sure to click on that like button on this page. I'm Dr. Ryan Kazemi, and welcome to Hints and Tips in Dentistry. Dental implants work by a process called osseointegration. What that means is that the implants must have a very intimate contact with the surrounding bone. In rather rare cases, however, implants may lose their bone integration and instead develop a soft, fibrous tissue union. Often the surrounding tissues get quite sore from the micromotion or movement of the implant, which can develop an inflammation. But in some cases, they may remain completely asymptomatic. Patients often feel that the implant feels loose or feels different than what it used to. Now, there are several simple ways to diagnose a failing implant with fibrous union. First, see if there's any mobility or movement of the crown or the implant. Second, take a routine dental x-ray, which often shows a narrow area of decalcification around the implant, which appears as a darker area around it. Third, you take a 3D cone beam CT scan that may demonstrate a bony gap if it's large enough. However, this may not be easily seen in milder cases, such as this implant. And finally, the dentist can use a probing instrument to check the gum tissue around the implant and see if there are any pockets. However, with fibrous union, the probing depth may appear to be normal if it's not pressed hard enough by the dentist. Now, there are several causes for development of a fibrous union with a dental implant. Some of the older press-fit type of implants were quite prone to such conditions, and this was because of their particular design and surface characteristics. However, this can also happen with contemporary dental implants. Now, often the cause of fibrous union can be a poor preparation of the site where the implant is placed, incorrect selection of the implant type in a given type of bone, poor stability of the implant at the time of surgery, and also micromotion of the implant during its healing phase. All of which are completely preventable by following proper surgical protocols. Now, the only viable treatment for implants with loss of bone integration is removal. They cannot be grafted in the hope of reestablishing integration. It simply doesn't work. Now, the removal of implants with fibrous union is not particularly a difficult task, but managing the site for replacement with a new implant at a later time does require some intricate steps. While for removal of integrated implants, we use the reverse torque technique, implants with fibrous union can simply be removed using a common instrument known as a forceps. And here are the steps. First, we create a gentle gum tissue flap around the implant. Next, we remove the crown if necessary. And for removal of the implant, we can simply use a forceps. This particular implant is an older type of implant which has no threads, and they're rather easier to dislodge. Next, the fibrous tissue and any surrounding inflammation or infection tissues are removed from the site and the area is totally cleaned. Finally, the site is grafted with bone particulate in order to both preserve as well as augment the ridge for future replacement with a new dental implant after about 4 months of healing. There's generally very minimal discomfort after such a procedure, and most patients can get back on their feet within a few days. So if you have a dental implant that doesn't feel right or feels somewhat loose, yet you have no pain or swelling or any other symptoms, it may have developed a chronic condition known as fibrous union. Unfortunately, such implants cannot be treated or saved, and their removal is the only viable option. Revision therapy with replacement with a new dental implants are often successful, providing that your team of surgeon and the restorative dentist are following the current protocols in implant placement. I'm Dr. Ryan Kazemi, and I look forward to seeing you again soon in our next Hints and Tips in Dentistry.